It's not easy to get a doctor in this country, and it's a dream of almost every family to have one. But what if your daughter gets a rank in top 100 in all India? Hi friend, this is Dr. Apurv Mehra, and with me is Dr. Deepak Marwah sir. It's an honor to share the same recording with sir always, being a senior from the
Pleasure, sir.
college and now guiding lakhs of students in the country beautifully every day. And with us in this recording is, I'm sure, a brilliant daughter of proud parents with a fantastic finish in this NEET exam. It's not easy to get a doctor in this country, and it's a dream of almost every family to have one. But what if your daughter gets a rank in top 100 in all India? And any day, these 24 hours of your life will be one of the top 10 moments of your life, Meemansa, I'm very sure.
Right,
Heartiest
sir.
congratulations.
Thank you so much, sir.
Tell us how you're feeling.
Sir, I'm feeling like it's a different feeling altogether. I feel so fulfilled कि जो भी मेहनत करी, somehow that has come to an end. And I've always dreamt of this moment कि एक दिन interview होगा, but I was pretty unsure कि पता नहीं होगा नहीं होगा. Now that it is happening, I'm totally satisfied.
Yeah. You know, this is just the beginning.
डॉक्टर साहब पूछना चाहेंगे आपसे, आपने कितने सवाल अटेम्प्ट किए थे पेपर में?
Sir, out of 200, I think I had left only 2 questions. बाकी 198 पूरा attempt करा था.
ओके, अच्छा, मोस्टली लोगों से जिनसे हम बात कर रहे हैं 190 प्लस तो करके आए थे. और आपके डॉक मार्क्स टोटल कितने हुए थे फाइनली? टोटल मार्क्स आपके
Sir, 662.
660. ओके, तो उससे आई थिंक जितने भी कैंडिडेट्स सुनेंगे वो थोड़ा नेगेटिव मार्किंग को कैलकुलेट कर लेंगे कि इतना होता ही होता है कि इतनी नेगेटिव मार्किंग आएगी अगर 198 करके आ रहे हो. ग्रेट. तो आपको लगा नहीं कि ज्यादा, मतलब मैंने बहुत ज्यादा अटेम्प्ट कर दिए, मतलब सेफ जोन जैसे 193 94 बोल रहे थे, तो 4-5 से भी फर्क पड़ जाता है कई बार.
Sir, actually,
Yeah,
when
you
I
were
saw the
sure.
paper, no, sir, I wasn't sure. But when I saw the paper, the first feeling that I had is that paper is easy and it's, you know, pretty feasible to attempt 190 plus questions in this. So I think 198 was a good choice.
और उसमें कुछ लगा आपको इस टाइप से कि कंफ्यूजिंग चॉइसेस थे या कुछ कंट्रोवर्शियल था? क्योंकि फीडबैक
Yes.
आया बीच में कि भाई कंट्रोवर्शियल भी है. मतलब आपका टेक क्या है फाइनली, कि इज इट लाइक ठीक है, स्ट्रेट फॉरवर्ड था पेपर या फिर कंट्रोवर्शियल था? लेट्स
So I
हैव इट फ्रॉम द
think
टॉपर्स.
for few subjects it was pretty straightforward, but for PSM, Gynae and Ortho, I think the options were pretty confusing. Like पहले go में जो लगा था कि paper easy है, later on it turned out that okay, I've made some mistakes. Be it silly or be it logical, they were mistakes.
गूगली. सर, ऑर्थोपेडिक्स के बारे में तो आप ज्यादा बता पाएंगे.
Yeah, Meemansa, we've been seeing a trend which is changing now. We are getting more questions which are clinical.
Right, sir.
The history or with an image where they will discuss, they will plant a background on which they will talk. And then they will give you options like an example of a fracture of the clavicle or humerus.
Right, sir.
Or they will talk about but everything that is there is practically that you see in the wards and in the clinics. That's the message, because that's the shift that is happening, right? But if you
Right, sir.
keep your calm, were you able to get these questions correct?
Sir, in ortho, I think except for one question, as per the recall, I got the rest of them correct. For Gynae, I think I got 2 wrong, and for PSM, I think I got 4 wrong.
Right, that's huge. So, you know, people choke at the end, you know, many people choke at the end. If you see cricket, South Africans are called as the chokers, right? And most of the people, they choke at the end. In what is your advice to the students for a perfect finish last 7 days? What is it that you did and you will say that that worked for you?
So first of all, it is important to realize that you cannot read everything in the last 7 days. So you have to be very specific and very precise, and it's very important to recognize कि आपका क्या weak है. For instance, my short subjects and third year subjects were extremely weak. So I had decided पहले कि during my last week of preparation, I will focus more on ENT ophthalm, psychiatry, ortho, radio, skin, and anesthesia. So I think everybody should realize what they're weak at. And most importantly, it's important to have a single source for every subject. Like you can read everything that you want, but end of the day, you have to compile it at a single place. That can be your coaching notes, that can be your annotated book, any kind of module, but it has to be a single source.
Sir.
डॉक मेरा क्वेश्चन था कि लास्ट के 1 महीने में आपने मतलब कैसे मतलब कौन सा सेल्फ मेड नोट्स पढ़े या फिर रैपिड रिवीजन यूज किया, व्हाट आपका अप्रोच क्या था लास्ट के 1 महीने में जब ये सब कुछ कंट्रोवर्सी वगैरह चल रही थी कि जी ऐसा हो जाएगा वैसा हो जाएगा एग्जाम पोस्टपोन हो जाएगा, तो तब आप क्या कैसे टाइम यूटिलाइज कर रहे थे और टाइम कितना वेस्ट हुआ ये कंट्रोवर्सी या हुआ या नहीं हुआ?
सर कंट्रोवर्सी में तो टाइम वेस्ट नहीं हुआ, बट एट दैट टाइम आई हैड माय इंटर्नशिप गोइंग ऑन, सो वहाँ पे काफी टाइम जाता था. Apart from that, sir, I had a mixed approach. Like for some subjects, I refer to my self-made notes only. But for some subjects, जिसमें मुझे लगा कि ये मैं भूल रही हूँ और मुझे एक बार दोबारा की जरूरत है, तो उसमें I had referred to rapid revision. For example, ENT and ophthalm.
तो उससे मैम फायदा क्या आपको लगता है, मतलब एज कम्पेयर टू, मतलब अगर कंपैरिजन में बोला जाए कि अगर हमें बोला जाए कि सपोज ऑप्थैल हमने पढ़नी है, हम रैपिड रिवीजन से पढ़ रहे हैं वर्सेस मेन वीडियो से पढ़ रहे हैं, तो मतलब एक तो टाइम तो सेव होता है, दैट इज ओके, मतलब उसके अलावा एनी अदर एडवांटेज दैट इट गिव्स, मतलब
Sir,
कुछ
it
हाईलाइट
depends that
पॉइंट्स?
when you are starting, like अगर कोई मुझसे पूछेगा कि इंटर्नशिप अभी स्टार्ट हुई अभी क्या देखना है, तो आई वोंट रिकमेंड रैपिड रिवीजन एट दैट टाइम. तब तो इट इज इंपॉर्टेंट टू हैव अ कंसेप्चुअल अप्रोच. बट इफ यू आर नियरिंग योर एग्जाम, देन आई थिंक watching rapid revision is important, at least for short subjects. इनका वेटेज इतना नहीं है.
मैम आप कितने घंटे रोज पढ़ते थे?
सर बहुत वेरिएबल है ये. With my internship, I think I was able to manage 6 to 8 hours in a lenient posting and 1 to 2 hours in a hectic posting. And sir, ये जो 8 दिन का 20 दिन का break था after my internship, during that I had studied for 12 to 14 hours per day.
तो ये मतलब
It's like a sprint, sir, going quicker at the end. That's what she did.
एंड लास्ट के 1 वीक में आपने कैसे मतलब क्या क्या टॉपिक्स पढ़े?
Sir, I focused more on previous year questions. So, उसी में से I had extracted topics, topics which were weak, topics which I had already bookmarked. So, बस वही पढ़ा for all subjects.
So when you talk about INI-CET versus NEET, right? A lot of students, their ranks are very close.
Right, sir.
But sometimes your rank is not that great. I would say that you got a good rank. You were in 140s. But then there are speculations that you've got INI-CET 140 and then in NEET there'll be a bigger crowd. So did you ever feel for a second that you will not be able to improve your rank in NEET? Because you have to pull up. Practically, if people around you, your close vicinity, get a single digit rank or a phenomenal rank in INI-CET, and the NEET exam is going to be very close. Normally, NEET is first and then is INI-CET. This year, it was opposite. So what was your, how did you pull it up?
So when I saw my result of INI-CET, I was like, okay, 145 is fine. But it's not, it's not a justice to the efforts that I've put in during my internship. So that was the time when my seniors and my friends, they came into role. I had a very good support system. I had my parents. They told me कि कोई बात नहीं, just work harder. Don't think about uncertainties. So I think that helped me a lot.
And we will conclude this video by the two most important people who contributed to your success.
Sir, definitely my parents, my mom and dad.
Yes, please name them.
And sir, my father, Mr. Rajiv Jindal, he is a businessman. My mother, Mrs. Shikha Jindal, she is a principal at government school.
So they are always the two most precious individuals. They are behind your success.
Yes, sir.
And I hope that you remember this from this video that once I was organizing a lecture in Delhi long back in 2014. It's 8 years back, my first lecture. I went to an auditorium and the auditorium owner asked me, "Where do you stay?" I said, "I stay at this place." And he said, "Ghar mein kaun kaun hai?" So I said, "My parents are there, and so my wife is there, and my daughter was just born." So he said, "Okay, so your parents stay with you." And my grandmother told me the statement, "No, sir, I stay with my parents." Right? And then he said, "I'm sure that the program that you're starting has a long way to go." He blessed me. This was my first lecture of Ortho Dhundalaka. This was the feeling. I had moved from an institute, and that's how the journey started. So if we remember these two names, मंदिर जाने की जरूरत नहीं है ना, क्यों जिंदल साहब?
सही बात है sir. Yes sir.
God bless you. And from our family of Prepladder, and from us, heartiest congratulations to your entire family, your parents, and you. I will
Thank you
request
so much.
Dr. Deepak Marwah sir to give the final comments.
Doc, it's been a pleasure talking to you, and thank you, sir, for inviting me for this short chit chat. And I hope that this would be useful, especially the inputs that she had provided. I mean, commendable with respect to studying even on days when she was doing hectic posting. 2 घंटे पढ़ना मतलब उस टाइम आदमी इतना थक जाता है कि नींद आ रही होती है, मतलब दिल करता छोड़ो यार, फेंको किताबों को. And I mean, I am amazed at her dedication, and I hope that.
I just wanted to mention one thing that in 2020 I had received a call from Prepladder, and I was chosen to be a member of League of Champions. So that was the time when many motivational lectures were being organized on Zoom quite regularly. So aapka lecture sir was something which I always look forward to.
It's been great talking to you. Thank you so much. God bless you, and best
Thank you so
wishes
much, sir.
from us and to your parents.
Thank you. God bless. Bye, sir. Thank you.
Thank you,
Take
sir.
care.